My name is Dr. Monica O'Mulan. I work as a research fellow in the School of Public Health, University College Cork. I recently started here working on my project, which is developing a health impact assessment implementation model. Previous to this, I worked for 8 years in the Department of Public Health in Trnava University in Slovakia. And my involvement with community health it varies, but mostly it's through my engagement with the WHO Cork Healthy Cities Steering Group, and also in various projects I was involved in Slovakia in relation to developing action plans for health with the local authority.
Okay. And how is community health organized in your country or region? And can you say something about the visibility? Is it well funded, and about the training of people?
Mm-hmm. I would say in Ireland in the last 20 years or so, it's definitely more visible. It seems to be better resourced, and there seems to be at a policy level, from a policy level down, more recognition about the value and the extent of a kind of economical benefit as well as a community health benefit. I would say, though, also community health workers seem to be very stretched and overwhelmed in their work. So I guess there's a problem with resourcing and also expectations of what the workers can deliver. So there's definitely work to be done there too.
And what have you learned in the past few years about community health, specifically about stakeholder engagement and mobilization of the community? This is the theme of our workshop. So.
Mm-hmm. That's a really good question, because actually, because of my involvement in the Cork Healthy Cities Steering Group, I've been inspired by the community health work that I've seen either through people on the committee who are working directly and indirectly with community health and community health workers, and also working on community health with groups in the community. And because I've seen this work and it's been so inspiring, I applied for funding from the Health Research Board in Ireland to do a project on health impact assessment, which is a process and a set of tools and procedures that can be used to assess the health impacts of a plan, policy, or project for the direct or indirect, foreseen or unforeseen health impacts and the distribution of those impacts, which can lead to health inequalities. And the project is very much going to build on collaboration and stakeholder engagement in the development of HIA and the doing of HIAs with the city authority, with the health service workers, community and voluntary groups, in order to do HIAs, but also to build a model that can guide future HIA practice in Ireland. And one aspect of it, which might be of interest to your audience, is we're going to develop a community engagement toolkit, very much inspired by the work done in Wales, so that we can ensure HIA in Ireland continues or will be ensure meaningful involvement of communities and not tokenistic.
Yeah. Thank you. My next question is, what role can community health play in improving population health and well-being?
Yeah, again, the value of community health in all its guises is really important in promoting population health and well-being. And I really think that this is on the mind of policymakers, and you can see it through the work that reaches out to the heart of communities and back again. As I said already, I feel like there's a lot of expectation on community health, the community health workers, and a lot of pressure. But there's a massive role to be played for community health. I think there needs to be even more recognition of the value that is played, and more, maybe not just resources, but more acknowledgement of that work, and I guess more funding would help in that, if there's that level of expectation on the sector. And that I hope that my project as well will show or highlight more the role that community health can play in enhancing population health and well-being, because by involving communities in assessing the policy plans and projects that are affecting their lives. And when they have a voice in that, it's really highly valuable and beneficial.
Great. And as a experienced professional, what advice can you give to the new generations of community health workers?
Yeah, I like to quote my friend Denise Cahill. She's the coordinator of the Cork Healthy Cities. She says often, never be afraid to fail. Keep having those conversations. Keep trying to collaborate. It's happened to me as well in Ireland and Slovakia that I've hit brick walls in terms of conversations and collaborations. And what I've had to do is pick myself up and find my tribe of people who are supportive in public health and in the broader community, and just to keep trying and keep collaborating together. And you'll always find those people that who'll work with you. It's a case of reaching out really and to keep trying.
Okay, thank you very much.
Thank you.